Good evening and welcome to our program, the Adult Children of Aging Parents Cape Fear chapter program this evening. The ACAP mission that we have is to provide information, resources, support, and community with programs for our caregivers. And it's not always about being the children. Sometimes it can be a spouse or it can be another relative in the family. So it's just information to help any caregivers. We do have facilities here. If you need the restrooms at any point in time, go out the door towards the reception desk and go right around to the right of it, and they're back in the back hallway. You have a couple papers at your seats this evening. You'll see the program schedule for the next few months ahead in advance, so you can make plans to join us for those meetings, and also feedback for today's program. We want to thank our sponsor this evening, which is Griswold Home Care. And if they would like to come up and share a little bit about their program, that would be great.
Thank you all for being here tonight on this hot July day. I'm Dorothy Griffin with Griswold Home Care, and I'm also the co-chair of our leadership team for ACAP. And I'm just really excited to be able to share these programs, because part of what we've found in doing home care is that often you have a crisis situation and all of a sudden you don't know what all you don't know. And so that's really our heart for these programs, is to educate you, hopefully in advance of those situations. With home care, you're going to hear about the continuum of services, the different resources that are available. And what we like about home care is that it can be a help for you, a partnership with you, all the way from just finding out if care is needed. One of the new things we have is some technology that can help you see what's going on with a parent, some of the trends, how much exercise they're getting, their gait speed, their sleep habits and patterns, and see if there's some changes that you need to be aware of. And then we go all the way through to the hospice end of helping to care for someone at the very end of their life, being there and just being able to provide that extra family member almost to help out. And that's how I first got introduced to home care, is when my dad had cancer. We brought in caregivers to stay awake during the night so that we could get sleep and truly be family during the day. So if you have questions about home care, we have some information back there. We have some magnets so that you can just stick it on your fridge, and when you need it, it'll be there. And again, thank you for coming, and hope that you'll enjoy the program. Thank you.
Thank you, Dorothy. And any of our committee members, our ACAP chapter members, have a teal green shirt on this evening, so you can see one of them. If you have any questions or want to ask about future programs or previous programs that we've had, feel free to ask them. I get the privilege tonight of introducing our guest speaker. She's going to talk about the spectrum of services, finding and using senior services in your local community. And it's presented by Ms. Shannon Jordan. Shannon is a community engagement coordinator for Lower Cape Fear LifeCare. She has worked in nonprofit field for 16 years and working with the senior population the last 11. She loves spending one-on-one time with seniors, and especially those that are in facilities and at the senior centers. In her spare time, she enjoys working with plants, flowers, and spending time on the water. So join me in welcoming Ms. Shannon this evening.
Good afternoon. How's everybody doing? Normally I would say come up front, but I'm going to tell you something. I don't usually start off with a joke, but right now I have canker sores in my mouth. I figured out that eating tomato sandwiches will cause this. I had friends come in town this weekend, and we went to the farmer's market. Then my neighbors brought me sandwiches. My dad brought me tomatoes, and I've been eating them nonstop. So if I sound a little funny, that is why. So I am Shannon Jordan. I am with Lower Cape Fear LifeCare. We were formerly Lower Cape Fear Hospice. Does anybody familiar with us? Show of hands. A couple of people. Okay. All of you. Okay. So we decided to change our names a few years ago because we added so many other programs than just hospice. So what I'm going to go in this evening is the different spectrum of services that we have. And I'm a very informal presenter. So if you have questions while I'm talking, please raise your hand, because I don't want you to forget them. Okay. So we were created in 1980 here in Wilmington and have been around near the hospital. Across from the hospital, we have a care center there. And we have a care center in Bolivia as well. And we have one in Whiteville. We range from up to Onslow County all the way down into Horry County. This morning when I checked the census, we had 589 hospice patients. We had 430 palliative patients, and we had well over that in our memory care partners program. So all together, every day, we service over 1,100 people. A lot of people don't think about that. So we have about 300 to 400 employees, and they are in those different areas that we cover, in the Onslow area, in the Horry County, in Whiteville, in Brunswick County, and the staff live in those areas to take care of the families in those areas. So I'm just going to go through each of the programs that we have and just tell you a little bit about them. So hospice care is for someone that has a 6 months or less to live diagnosis. Now, is that always the case? Absolutely not. Think about Jimmy Carter. He's been on hospice for a while, right? We have patients that have been on hospice that I have done bucket lists for, which I'll cover that in a minute, for over a year. And so what we've found is that if we can get to these patients that need hospice care sooner, that we can get their symptom and pain management under control, and their quality of life is so much better, which then can extend their life as well. Now, you do not have to have a physician's note to be able to be on hospice. People think that hospice has to be a written order. Actually, if you think your loved one may need hospice, you can give us a call. We'll send a nurse to your home. We'll do an assessment. And then if we feel that they need hospice, we will then contact your physician. Hospice is covered by Medicare and Medicaid. So they are the ones who decide whether someone is eligible for care and how long they can be on care. We are a nonprofit agency, so we turn no one away with inability to pay. We have took care of recently, unfortunately, people that are homeless as well. At LifeCare, we take in about $1 million a year in indigent funds. And the way that we do that is we have several different types of fundraisers. So has anyone been to the Last Chance for White Pants? Anybody in here? Well, it's a big party that we have. It's in September. And it's the last Saturday of August, because you're not supposed to wear white past September, right? That's Labor Day. So we have a big party. That's one of our fundraisers. Has anyone been down to Fort Fisher to do the Festival of Trees? Yeah, a couple of people. So we sponsor the Festival of Trees. Though we don't make money from the proceeds of you paying to get into the aquarium, we make wreaths. And I have to say, my wreath won last year. I made the best wreath. But we make money from selling the wreaths, and we also sell little angels that you can put in honor and memory of someone on the tree. And that is the way that we do fundraisers. We also raise our money by having families. They do donations. A group of people can go in and they can donate up to $1,000, and they can put a plaque, they can make a plaque or a butterfly. We have these beautiful copper butterflies that we do. And then we have a big ceremony that we do a couple times a year. We release doves, and it's beautiful. So it's a recognition and memory of, and that's another way that we raise our funds for hospice as well. But hospice itself is, a terminal diagnosis, 6 months or less left to live. And then what it does is it brings in a team of professionals to help that loved one. So you not only have a physician, you also are going to have a nurse that comes to your home. It can be done in the nursing home. It can be done in the assisted living. Like I said, we have homeless patients. It can be done wherever you are. But we bring in the nurse. We also have a CNA, which is certified nursing assistant. And what they do is help with bathing, like housekeeping, and help the family you get really bonded with this group of professionals that are with you. You also have a social worker that helps organize all the different professionals that are coming in, but also help support you as well with any doctors that you may have and things that are going on in your life. You will also have a bereavement or a social worker that will help with end of life conversations, and also to pray with you if you're religious. We are non-denominational, but we meet the patient where they are. So you're also going to have a bereavement and grief support team as well. Hospice also provides, what people don't realize, is it provides the medication. So we pay for them, and we also pay for medical equipment as well. So any toilet seats, beds that you may need, a hospital bed, anything that you may also need is also covered. And the reason that we go out and do these presentations and talk to people is that people think of hospice as just that last week of life. And unfortunately, that is when we get so many of our patients, is really that last 8 to 10 days. That's when we get the most. And then families say, I didn't know I could have done that 6 months ago. Oh, I would have loved to have that 6 months ago. So people just don't realize what hospice can do. And it's not just that end of life. It is the end of life, but not less than necessarily those last few days. It can be 6 months, a year to help support through that. So does anybody have any questions about the hospice care piece itself? Okay. So we're going to move on to palliative care. Palliative care is when someone has a life-limiting illness, but it is not that 6 months or less terminal illness. It is when you have an illness that is, we'll give you situations, COPD, congestive heart failure, Parkinson's, MS, cerebral palsy. Those types of different diseases can use palliative care. And then all cancers are under palliative care as long as they're not a hospice patient. Palliative is also covered with Medicare and Medicaid, but what it brings is a nurse practitioner to come to your home or to where you are, whether it's again, skilled nursing, assisted living, your apartment, wherever you are. It brings in a nurse practitioner to help you with pain and management symptoms. This does not provide a physician. This just provides the nurse practitioner to the house. But she will also work with your different physicians to help organize your pain and symptom management. So let me give you an example of that. I worked with a lady who had breast cancer, and she's about my age, and I said, you need to call and, try to call and get on palliative care. And she said, I'm too young. I was like, first of all, no one's too young. We have children up at LifeCare. And so she called, and a nurse practitioner went to her home, and while she had to have her double mastectomy, then she had to go through chemo and radiation, she had that nurse practitioner, or it can be a PA, but I've only seen nurse practitioners since I've been working there. But she had that support while she was going through all that. She's back at her job now. She's doing well. And of course, we pull out of there. Same thing in a nursing home situation. Someone's COPD, especially with this hot weather, they're having a hard time breathing. They can't function well. So we come in, we can, order what they need to help them, whether it's inhalers or medicine, to get them to their optimal level and get them back. And then we can pull out of there. And so that's what palliative care is. Now, when I say it's covered by Medicare and Medicaid, I don't want you to think it's completely, fully covered as far as each insurances are different, so there may be a copay. So it's kind of whatever, because it is covered under Part B. So just want to make sure that you understand that piece of it.
Shannon?
Yes.
The conditions that you mentioned for palliative, was that it? Or
No.
are there other?
There's others. That was just kind of giving you an example. So it's really anything that's life limiting, that's keeping you from living your life to the fullest. It could be, there's so many different diseases to name them all. And if it's something that you feel, or you have a patient, or you have a loved one, or you yourself have that, you can give us a call, and we have what's called a PAC team, and they will talk to you and figure out if they're able to do that with you.
Thank you.
Yeah, you're very welcome. Any other questions about palliative? Okay. So I'm going to go into my memory partners, and I'll try not to talk for an hour just on this. So this is near and dear to my heart. Memory Partners program was created a couple years ago by a grant. We got $1 million grant. We were getting calls from physicians saying, this person's got dementia, they need to be on hospice. Now, while dementia is a hospice diagnosis, not everyone is in the hospice track when they have dementia. They could be in the beginning stages, they could be in the middle stages. They're not necessarily at the end stages. But the doctors were sending all these calls to us, and we didn't know what to do. So we applied for a grant, and we got $1 million grant to help for people with dementia. So what we decided to do with that was to create a Memory Partners program where we actually help caregivers who are taking care of someone with dementia. This is very near and dear to my heart because I did work in a skilled nursing, and I did work around a lot of people with dementia. I felt I was really, really good at it, especially during Hurricane Florence. I feel like I nailed it. Well, then my mother-in-law got dementia, and you could throw everything I know out the window. When your heartstrings are attached, it is completely different emotions when you're taking care of someone. I was one of the first people on the Memory Partners program, so I know how beneficial this can be. Our grant has since run out, but what we did, we decided this was so important that we created our own 501(c) to keep this going. And so now we're starting to spread it out to all the different counties as well. But what Memory Partners does is it brings a nurse practitioner or an RN or a master of social work into the home to kind of do an assessment to see where your loved one is that has dementia. And then they set you up with different care. They create a care plan for the trajectory of the disease as best as they can, but they also support you during this. So they have a 6-week Savvy Caregiver class that we present. We also have, which was most beneficial to me, was the peer-to-peer support. So when I could call up someone that I had met in that group and say, "Oh, this morning, she couldn't even tie her shoes this morning, but yesterday, she was completely dressed from head to toe. Or today, she's using the comb, trying to put toothpaste on it, and my whole house is a mess." And I could talk to someone who was going through the same frustrations as me. Because sometimes, I say most times, it's better to laugh than to cry. So when you get to talk with someone, they can tell you what they're going through this as well. With our Memories Partner program, we also provide a voucher for families to get some respite. And I say, most times you would think that person would want to go to the grocery store, go shopping, maybe meet a friend. No, most of the time they sleep. They know their loved one's taken care of and they are exhausted. And I can tell you from taking care of someone with dementia that caregiving, regardless of whether it's dementia or not, is very exhausting. And so to have that respite for them is a wonderful program. I definitely use that, and I was very appreciative for that. So that is our Memory Partners program. Any questions with that? Y'all are quiet.
How does respite work? Does someone come to the home?
So for Memory Partners, they do. We have 2 different types of respites, and I'll go ahead and get into respite to answer that. So that's a great question. We also provide respite care at our care centers, but that is for our hospice patients, okay? So Memory Partners respite is in their home or where they are at, and that is hourly. We are partnered with certain home care companies to provide that are also dementia certified. And we also have volunteers that we have trained in dementia to do that as well. But respite itself, a different type of respite, like a family member wants to go on vacation or wants to go to a wedding shower or a baby shower, we provide respite at our care center for 5 nights every 3 months for our patients. For our hospice patients. I know from having worked in skilled nursing before that when the care center was full, we've actually used nursing homes as well, especially when families have a specific event they're trying to go to, that we can provide that. It's also very important so that they can get that break that they need to. And then at the care center, they're going to have doctors and RNs and CNAs round the clock there taking care of them. And so now kind of what we're talking about, the care center, our care center is used for that respite, like I was saying, for caregiver breaks, but it's also used if any of our patients are having an off moment or their medications aren't right. I'm sure you've probably heard if you work in the senior field or taking care of senior that someone gets a UTI, it completely changes their demeanor. So for example, if a patient's going through that, we can bring them into the care center. We can figure out what's going on with their medications, figure out what's going on with them, and get them back to their base level and then let them go back home. So that's a way that we do respite as well. Yes, ma'am.
Does Medicare pay for the respite?
Yes. Yes.
Please repeat the question for me.
Does Medicare cover respite? Yes. Thank you. You have to remind me every time. Any other questions on Memory Partners? Okay. All right, so we just covered the respite part as well. So we also have a veterans program. This is We Honor Veterans. We are at our level 5, which is the highest level that you can be at, which I'm honored to be a part of. Right now, we get patients, unfortunately, that served during Vietnam, and they weren't treated very well during that time. So we definitely want to make sure and take the time to honor them. And ways in which we do that is if a patient of ours comes to our care center and we know that they're a veteran, we make sure that the door is decorative and that they know they have a nice wreath on there with flags and everything on it. But we also do vet-to-vet pinning. And vet-to-vet pinning can be done in the home. It can be done in the care center. And this is one of our volunteer programs that we have, and I'll get into that in just a little bit. But vet-to-vet pinning is really, it's much for the veteran as it is the family. But we have veterans that have volunteered and they come in and they pin the person who is on hospice with a flag and thank them for their service. And I can tell you, I just went to one recently, and it was so heartwarming. We were in the house, and of course, the family's thankful and grateful. This gentleman was actively passing, and he was not awake. And so the gentleman still went in there and thanked him for his service and pinned him. And as we were walking away, nonverbal, actively passing, raised his hand and saluted. I'm gonna tell you, woo, not a dry in the group. And so that's something that we do, and families are so appreciative of that, and we give them a plaque as well. But other ways in which we honor veterans, I go out and do veteran cafes. And so we just go out and give a safe space for veterans to talk about their service and mingle and meet other veterans and give free food and lunch and talk and just kind of hang out. We also, I don't know if any of you have ever heard of the honor flight. So we do part of the honor flight as well. Our social workers are trained to help our veterans obtain VA benefits if they haven't been able to get them. So that's very important to do, get the benefits that they need. And they also are trained, and nurses trained, specific ones trained to deal with PTSD, with grief support, guilt, those things that the veterans go through. We have specific teams that are trained to work with them specifically. So, all right, let me take a little sip of water, y'all. Yes, ma'am.
I had a question about having the social workers help them to get the veteran benefits. Is there any qualification they need as far as the hospice or palliative or memory care, or that's just if they're a veteran that you help them?
If they're a veteran, we'll help with that. And I also can say I met a lady at the Veteran Services in Pender County, and she has said for me to tell anyone that will listen that even though she's in Pender County, she would be happy to help fill out any forms for veterans. For VA aid and attendance and all that. Sometimes it's hard and you miss one period, you miss one thing, you don't get these benefits. And she knows how to do it left and right, in and out. She's a veteran herself, and she is willing to help anyone do that as well. And we're partnering with her to make sure that we're getting all these forms done right so the families can get the finances that they need as well.
Say that for the spouse too, because.
Yes, because there's yes, absolutely. All right, so now I'm going to talk about our grief care. So as a hospice benefit, we have to provide grief care for our patients, and all the other hospices typically do it for 12 months, and we go for 13 months. Anybody know why? So we want to get past that year mark, because that's the hardest part of getting that, that year it comes again, and you've done so well, and now it's hit again. So we want to follow that patient for a year. We also have community grief support that we do as well, especially around the holidays for loss of a spouse, loss of a child. But even if you were not one of our patients, I had a lady that came up to me at the senior center and she said, my husband died 7 years ago. I don't know why I'm still crying. And she had already heard my program. And I said, please call us. It doesn't matter if you are a patient of ours or not. We're still going to provide you grief support. We'll do 4 free sessions. And then we will lead you in. Typically, that kind of works for what the person needs. But if they need more, we will connect you with a counselor. So that's something that we do in the community. So if you know anybody that's grieving, we have so many people that have moved from out of different places, transplanting here. And maybe they left because they've lost their spouse or lost a loved one. Please have them call us. We would love nothing more than to help them out. We also have Camp Voyager. That was really sweet this year. Camp Voyager is for children who've lost a loved one. This year we had a child who was nonverbal after he lost his mom, and by the end of camp he was speaking this year. So that one was pretty. I really love that, But they have little pet camps that they do, and we bring in dogs for them, and we have all types of arts and crafts, and they're there with us for a week on campus. And they typically would have lost one of their parents or someone really close to them in the last year. So we have Camp Voyager. We also have expressive art therapy as well as part of our grief support, and pet therapy. So we have a whole volunteer side, which I'll get into in just a minute, but the pet therapy is part of that. So if we have a patient that's missing their animal or would like to see a pet, we just call up one of our pet therapists and they will go to the home and get to spend time with the patient that we have. So that is kind of our grief section in a nutshell.
Is the children's care limited? What's the age range, and is it limited?
Is it?
We
Oh, how many that we have? Or
right,
limited?
We have family, and the 2-year-old died and she had 5 siblings. So they all are just like, they watch the whole thing unfold.
Oh.
And so would that be limited? Can they all go, or is it?
I would think so. If they have space, absolutely. Absolutely. Yeah. It's from what I saw, and that's a great question, and I honestly don't know the answer to that. But I saw when I was there, it was about 15 children. And I would say, I mean, their ages really ranged, but it was more from the 5 to 12 age, 5 to 13 maybe age. But it was a wide range of ages. But I think once you're 16, 17, you're probably age out of that. But I will certainly let you know.
I just didn't know because they have each other already, but then it's such a
Yeah.
wide age range in family.
Yeah.
Because it probably goes from 5 to
And is this recently?
16, yes.
Sounds like we need to just get a children's counselor in there, period.
Well,
into the home.
They have hospice. But I was just wondering about the camp, would they all be
Yeah.
allowed to go at the same time if they wanted?
Yeah.
Okay. And then that would be really, if they're all ages on the same group, it would be interesting
Yeah.
conversation because of the age range.
Yeah. Yeah. That's a great question. I'm not really sure exactly how many, but I knew there was a lot there this year. So I would think they would be able to. I can't imagine why they wouldn't. But I can check on that for you for sure. Volunteers. So we always need volunteers. During COVID, we lost over 200 of our volunteers. And so we're building that back up. New Hanover and Brunswick County is doing good, but more of our further counties, Pender County, Onslow County, Horry County, we need those. Different ways that people volunteer are we have a thing called Meals of Love. So at our care center, you can bake food. Chelsea back there is one of our, she provides us meals. Families absolutely love that because they're not wanting to leave their loved one's side when they're at the care center. So they go in there and they get to eat and they don't have to leave. People think, giving back and volunteering is always going to be sitting with a hospice patient, and that's not the case. Although I have to remind you that people think of that hospice as someone in a hospital bed that's nonverbal, and that's not true because we're getting these patients earlier and earlier. So really, our hospice patients a lot of times just want somebody to play games with or watch a movie with or, cook dinner together, hang out, just talk about kind of what they're going through. So that's ways in which people volunteer. Pet therapy is a way people volunteer. Going to festivals with me is a wonderful way to volunteer. So I set up at a lot of different festivals just to educate people. And the funny thing about festivals, the first festival I ever did was the Mullet Fest in Swansboro. I don't know if any of y'all have ever been. It's a great festival. And there was hundreds and hundreds of people there. And I was so excited. I just started and I made this big giveaway basket for volunteers that signed up. And I had all this candy because it was near Halloween on my table. And I had a gentleman to the left of me that did woodworking. And I had to the right of me a lady that sold books. And so it kind of went like this. So they would come and they would look at his woodworking and they would be there and I'd be like, okay, I'm getting them next. And then they would see LifeCare and they would go beeline all the way around to this lady. And the kids would reach for candy and they're like, no. I can tell you, people don't like to talk about end of life. They don't like to talk about hospice. But it's something that we're all going to be there at some point. So it's so important to spread the word and to let people know how we can help them through these services. But just kind of joking, but that's a way you can volunteer as well, is helping out at festivals. But we've got a whole list of pages back there of different ways in which that people can volunteer.
So you can chase people down and bring them to that.
That's right. So the last thing I'm going to talk about is our community education. So community education is kind of what I'm doing now, which is what we call LifeCare 101 or a spectrum of services. But other ways in which we go out and do community education is a class called Begin the Conversation. Has anyone done this before? So Begin the Conversation is a class I teach, and it is about end-of-life planning. It is called Time to Face the Elephant in the Room. What we find at hospice so many times is as the person is in the care center, the family is scrambling to figure out what that loved one wants. So we call this giving a gift, giving information for tomorrow. I can tell you that when someone is passing, that is not the time to figure out if they want to be cremated, if they want to be buried, what kind of service they want. It is not the time. We started this program because I don't know if any of you remember the Terry Schiavo case. I did this, y'all, recently, and the whole group was 20, and nobody knew what I was talking about. And I was like, and I always think of myself as young, and I was like, I have just aged myself. Not a person now. But Terry Chavez was the young lady who went on life support. And half of America agreed with her husband that said, you know, let her go, let her pass. She would have never won this way. They had these conversations. And then the other half of America agreed with the family, her parents, who said she was young. Miracles happen every day. Let her live. And I don't know if y'all remember the years that this went on. It went on, and it was all over the TV. They were outside the courthouses protesting. They were outside the hospitals protesting. And it went on for years. And then they created the Jeb Bush. They pulled the feeding tube. And she finally did pass. And to this day, this family doesn't speak. But sadly, these things happen here. We see this all the time. I mean, probably TMI here, but we had to go on lockdown because somebody pulled a gun on a member in our care center because they were fighting over this. This is not the time. Now you've infected all these other families that are grieving during this time. And you've got staff worried. I mean, everything was fine. But it was really because that person was so heated over these conversations that it's not time to have these conversations at the time. I can tell you my mom died when I was in my 20s. And I remember sitting there in the room, you know, at the funeral parlor. I don't think they call it that still, but at the funeral parlor. And they said, you know, what color do you want the inside of her casket to be? I can tell you, I did not care. I did not care what color that I wanted that to be. And in my head, which my dad was like, Shannon, that's a terrible color. Her favorite color was maroon. Now look, that's a vampire. What are we doing? You know, I wasn't thinking she loved the color maroon. It was her favorite color. You can't put that in there. And it's just not the time to figure these things out, right? And this happens over and over. So we teach this class, I teach this class, and my supervisor teaches this class, and begin the conversation. It's about end-of-life planning. It talks about all these things that you wouldn't think. This book that we have is amazing. I mean, it talks about where are these passwords to your Duke Power bill that's going to keep coming? Where's your living will? Where's your healthcare power of attorney? Do you have a prenup? Things that the family is then spending. I have two girlfriends that are from Florida. They just visited this week. We had the best time. But their dad died on New Year's Eve. And they were like, and he was still able to talk with them until the end. And they were like, Dad, where's your information? Where's your information? And he was like, it's in the cloud. It's in the cloud. So he passed away. Now, they both were teachers. They both still are teachers. But they both at the time had second jobs because teachers don't make very much money. And when he passed, they didn't have the money to bury him. Now, this man lived on the water, huge boat, RV, Corvette, big house. They didn't know where anything was, couldn't get a hold of anything, had to end up getting a lawyer to figure all this out. What if he'd have just said, you know, he was trying to still be funny towards the end? Well, it wasn't funny. So these things your families need to know. People don't like to talk about this because they think, oh, it's going to bring death around sooner. Well, I would be dead because I've been talking about this for about 2 years now, and I'm doing pretty good. And so I just think it's so important that your families know what you want, and so that your legacy is known as well. If you loved cats or you loved working at the church, wouldn't you want people to know? Or would you want a Catholic service if you weren't Catholic? Would you want to be, you know, I can tell you, you see all the time that different people have different prayer services that weren't that specific denomination, just because the families didn't even know what the person wanted. And so I'll get off my soapbox on that. But that is just so important. Begin the conversation. We have the clinic the third Friday of every month. I've got cards back there. And if you belong to any churches, organizations, home care groups, anything that you think that you would want that brought to you, I'm happy to come out and do that, or get someone to come out and begin the conversation. Other things that we also do is we have an RN that does education, and she teaches classes on falls prevention. She teaches classes on, we do ABCs of dementia, different types of dementia and the disease process for that. We do healthy heart. We do interactive skills, showing people what it feels like for your loved one to have dementia or have COPD. We go through different heart disease as well with that, so that you can kind of understand in their shoes what that's like. I went through that years ago, the dementia training, and it was eye-opening. to have that, to feel like that person and to understand, what they're going through. So we do all types of different trainings as well as that. And that is kind of all I have. Yes, ma'am.
Do you have a list of the end of life requests or questions that you would ask a loved one, about their service, their funeral service?
Yes, it's called Begin the Conversation. Yes, I have books on that. Yes, I can get you one. Yes, I didn't bring any tonight. I didn't know I was going to quite go that way. I never know what's going to come out of my mouth. But I do have the books, and I'd be happy to mail you one, or I can meet you at the office and get you one. But they are wonderful. It is a wonderful book. I'm also a notary, so I go through the living will with you as well, and your healthcare power of attorney. And so we do that free. Myself and my boss goes through that. I'm gonna take a sip of water here because my cake is sore. Give me a second. I'll tell you more about that.
The most one will help answer the questions about life-sustaining care. There's the golden rod, which is do you do CPR or not? But then the most form is, do you want a feeding tube? Do you want
Antibiotics.
Do you want IVs? And stuff?
Now, we can't do a most form or a DNR. Your physician has to do that. And we do that if you're a hospice patient. We do go over that with you. But if just in general, 18 or up, you should have a living will and healthcare power of attorney. I know when I was in my 40s, my doctor asked me before I started work here, did I have it? And I was like, oh, I'm too young for that. No, I'm not. You never know what's going to happen. I will say I'm really proud of my niece, though. She just went to Appalachian this last year. She just came back, and she called me up, and she calls me Aunt Shay. And she says, Aunt Shay, I want to fill out one of them things you talk about, them living wills. And I was like, what? And she said, yeah, because if I'm up there and I'm snowboarding and I hit my head and I end up in a coma, Mama's going to leave me that way, and I don't want to be that way. And I said, okay. So I called my sister and I said, Maddie's wanting to get her living will in case she ends up in a coma. And she said, well, you know what? She's right. And I said, okay. I said, well, I'll give it to you to fill out, but I'm going to have my supervisor notarize it because family can't notarize it. And so we did. We filled our living will, and she took it to Appalachian with her. So, any age, it's good to know. But
writing the ending to your story.
It is.
You want it.
That's right. That's right.
Somebody else is going to steal it.
That's right. And I have had great conversations, especially the senior center. They're my favorite. Like I've had one lady, she's like, I'm getting buried in a reef. She loves to snorkel. And I'm like, that's a great idea. So do I. And people, you don't see, and Chelsea could speak for this more, but you don't see the typical funerals anymore. I mean, you're seeing more people getting cremated and they're taking their ashes and doing just, I would like to be buried under a live oak. I mean, I've heard so many different things that people want to do now. And it's just really unique and interesting. And I think that's so important because it's your legacy. Like you said, it's what you want to be known for. The living will healthcare power of attorney, what it does is the first piece will ask you, if you are unable to make a decision for yourself, who do you want your number one to be? Who do you want? And typically it's a spouse or a sibling or, someone in your church. Some people say, I've lost my husband and I don't, have children, and say, is there a church support, neighbor, someone like that. But you pick that first person to make that decision for you. And then you pick your second person. And that's the first part of it. So that part's done. And then you go to the next part. And it asks if in these 3 situations, would you want to be on life support? And the different situations are basically that to a certain degree that you're not going to regain consciousness. Would you want to be on life support? And it goes through that one. Then it goes through if you have advanced dementia, would you want to be on life support? This is not your typical normal aging, standing in front of the fridge, can't remember what you got there. No, this is progressed dementia where your body is breaking down. Do you want to be on life support? And that's the second one. And the third one, honestly, I can't remember off the top of my head, but it's something to do with, being at the end stages of life. And then it asks if you want to be a donor of your organs. And then it asks if you want a feeding tube. That one gets tough. And that's a question we get asked in hospice too, because people think, oh, she's on hospice, they stop feeding you. That's not necessarily true. When your body is actively passing, you don't need the nutrients to keep going. So we're out and about. We came here tonight. We're hot, we're sweating, we're moving, and our body needs all this nutrition. But when you're laying there and your body's trying to shut down, it's time for you to pass, your body doesn't need that nutrients. And it can make things worse for you. So just kind of asks that question as well. And then it asks, this is a tricky part though, then it asks, do you want to follow this Do you want the physician to follow this document exactly how you want it, how you said you wanted it, or do you want them to, if there's any changes, allow the person you picked in the beginning to make changes from what you said? So, and that's on there as well. And then we just put our little stamp on it and hand it back to you, and you take it to your physician, and then you keep a copy for yourself, and then you of course talk to your family about this, what's called begin the conversation. So you begin the conversation with them ahead of time. I can tell you my dad did this. It's crazy. I work at hospice because to hear my stories, my mom died, and then my dad called me. I was probably in my 40s too, and he said, I'm just going through the will, and I just want to see, I know we've got this house, the house I grew up in, and I plugged my ears and said, la, 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 la. I didn't want to talk to him about it. This is my 40s before I started working here. And I didn't want to talk to him because I didn't want to talk about end of life, because how much I am a daddy's girl, and it just broke my heart. But now that I've done this, he's of course done a living will and healthcare power of attorney, and I talk about, it's so important. It really is, and it makes a difference. And if your family don't want to talk about it, if you can just bring a little bit, just ask a few of these questions, and then just ask a few more and a few more, because ultimately all of us are going to be there one day. And so I think it's so important to have that legacy and the end of life. We're always there when, we have the baby showers and we have the weddings, and we all, are part of that. But I think being a part of the death is just part of the process too. And I think that needs to be honored and respected just as much as any of the other pieces.
I worked in a nursing home for 20 years, big ones, and the fights in the hallway, always the siblings in the hallway. And we would have to ask them to leave. Like, you can't disrupt everybody in here.
Mm-hmm.
And so there was one that was so bad, the family, every one of them were fighting. And I told my parents, I called them Brian, I said, I want you, because they had done the living will, they had everything in place. I said, at Thanksgiving, I want you all to say out loud what your wishes are and what's going to happen, because I want my siblings to hear it from your mouth. Mm-hmm. Because I didn't remember being ones fighting in the hallway. Mm-hmm. That was terrible. Yeah. And so at Thanksgiving, my brothers were mortified. They were like, oh my gosh, yes. This is crazy. And my sister and I, we were the two older ones, and that's what I do all the time, right? I come around this all the time. But they each one said what their wishes were, that it was documented, and this is what's going to happen with whatever's left. They were very specific, very detailed, and they were like, my dad, he's like, there will be no fighting.
Yeah, it is so important. Like my sister, just kind of tell you a little bit about her, is completely opposite of me. Like, she could never stand up on the couch. She's retired at 50. She's never worn a dress except when I put it on her for her wedding and her prom day. Never wore makeup except when I put it on her. You'll never see me in pants, very rarely. She's very shy, very meek, doesn't even like to drive on the highway. And I'm like, where are we going? And in my dress and in my makeup. And so I thought, if something were to happen and she had to make this decision, it would devastate her. Like, it would devastate her. She would not have a clue. And her favorite color is baby blue. I'm like, she would have me in a baby blue casket, which is my least favorite color. And God knows what dress with tons of rouge. It's just like, I think she needs to know. But same thing with like my dad. I told him, I said, we'll talk to Sherry, but she wouldn't want to make those decisions. I'm happy to make these decisions for you. Let's go ahead and move forward and put me on, your healthcare power of attorney and your wife, your wife and then me, because she just could not. It would crush her. And so you got to really think about, it's not all about you at this point of you not wanting to fill it out. It's really more about your loved ones and helping them.
Does the Start the Conversation have the database to record, like she was asking, like the details of your accounts and
So it's all in this book, but we're working on getting it electronically, because I'm like, we got to catch up, people.
Somebody gave me one, and it was after they did the presentation years ago. And I have an
electronic version. Yeah.
Yeah, and it has bank accounts, passwords, the electric, the water, everything. And so I send it to my sister.
Yeah.
In the event that something happens to me, and then she has access to all of my information.
It took my sister-in-law, when her in-laws both passed around the same time. It took them forever to get like Netflix and all that figured out. I do have to tell you this really funny story. This just happened. I haven't told this in any of the classes, but I just got to tell you this. So my stepmom and I are identical. You would think if you ever met her, everyone says, oh, it's really nice to meet your mom. She's just like, well, her mom just recently died, and she was actually on hospice more than a year. And her mom just recently passed, and she did not do the begin the conversation, and she was trying to get all the stuff turned off. And so she was acting like she was her mom. This is hilarious. I found this hilarious. My dad had to call and tell me this story. So she's on the phone with Time Warner Cable, trying to get the cable turned off, and she's talking to this gentleman. And so she's acting like her mom. I'm Fran, And so he's like, and so she's like, yes, I'm Francis, blah, blah, blah. And he's like, what's your birthday? And she rattled it off. My dad's like, that's pretty impressive. And he's like, what's your social? And she said, hold on, let me get my death certificate and look it up. My dad's like, at that point, I was like, oh. She's like, but the guy didn't even say anything. She still got to cut it off. He was like, she was doing so good. She had the address. She had the birthday. He was like, and then she's like, hold on, let me look at my death certificate. So anyway, so you have to go through crazy measures to get things turned off. So how many one little needs? So, yes, ma'am.
So the power of attorney and all those extra questions, that's also in the book? or
Yes.
is that on-
So the book, yes. So the Healthcare Power Attorney Living Will is a separate document. And then the book is just a book that you keep for yourself that goes through things of like, would you want music in your room when you're passing? Like I would never want TV. I don't like TV, but play a harp, I love that. And ask you different things that you would want. Do you want flowers? Do you want someone beside you? I would want somebody to, with me, but we have a lot of families, loved ones that they wait until everyone leaves before they pass. Everyone's different. So I asked those different type questions. Everything you could think of is in this book. And do not fill it all out at once. I did that when I first started working here. And I was like going through the book. I'm like, whew, do not fill it all at once. It takes time to think about it and go through these things. But it is a wonderful book. I wish I had brought some tonight too. Yes, sir.
Regarding documents, we moved here from another state.
Yes.
We have all the documents, wills and trust and living, power of attorney, living will and all that. Do they have to be recreated?
You need to do them for the state of North Carolina that you are in. It is best to do them. Will they work? Most likely, but especially that healthcare power of attorney living will, you need to have it for your own state that you're in.
Do we have to go to a lawyer or do we just get papers filled out and give them to our physician?
So the living will and healthcare power of attorney we can do at our clinic, or I can do them. But anything financial that has to be done by the attorney. Yeah, we don't get involved with those. Yes, ma'am.
There is a resource that I found on Facebook of all places. I haven't even told you two about this, but it's, it has its own, website, but Knockbox.
Oh, yes.
NOK, next of kin, Knockbox. They will send you the entire system, or you can just ask for the labels, and then you have 67 file folders to put a label on that has everything from bank accounts to, it is every piece of your life, including things like passwords. And it provides a place for a copy of everything that your life is involved in. It's incredibly comprehensive. But it is one place that your power of attorney or family member or whatever
They can get to.
Can get to, and everything about your life is in there.
That's
You're not uploading it online, it's just sending you something to organize that.
Right.
So you keep it on your desktop or your.
Well, no, they send you a system, so, it's paper.
File.
Oh.
Yeah,
Okay.
it is a file. But
Okay.
like I said, they send you, I took the low cost route, but it is a series of labels. And like I said, it took 67 file folders to put all this together. And I'm still working on all the pieces and parts that go into those file folders so that everything will be there for the person who has my power of attorney. But it's pretty amazing and extremely comprehensive. And it was $49.
Thank you for sharing.
Okay.
So does anybody have questions about hospice, palliative, our memory partners, begin the conversation? Any of the stuff I've gone over?
You did a great job.
Yeah,
Thank
you've
you.
done a really good job.
A lot of
Thank
good
you.
information.
Thank you. I appreciate that. So, yes, ma'am.
Do you find that more people like to go to the facility at their time of passing, or do they like to pass at home?
It's so, I would say at home. Yeah, if they can pass at home. And typically when they come to a care center, it's one because they're their spouse is aging too, and they can't do that turning of them so they don't get better, they can't do that care. Or you do have families, which I completely understand. It's like, I don't want somebody done at my house, so they do that. But typically, yes, because we only have 16 beds in that care center, and then 8 in the other, and 7. So I would say it's definitely more at home for sure, if they can, if they're able to. And it's really preference, if they need that care. That's a great question. Thank you, Chelsea. Any other questions? So the information's back there. The little card for begin the conversation's back there, but my business card, so I'm Shannon, is back there. If you want to get a book, I'm happy to meet you. The care center is at 1414 Physicians Drive, which is across from the hospital. I'm happy to leave some up front for you or meet you there and kind of go over that. But like I said, the third Friday of every month, we're there anyway doing it. So
At that location?
At that location, yes. And then, like I said, I'll do it at any church or group. I say if you got 5 or more, I'll chit chat. I'll do it there.
Okay. Any other questions for Shannon? All right, thank you so much. Yeah, I was looking to see if we had any of those books where you fill out all that information, because we did have them in the past, but we don't have them right now. Thank you all for coming. I know there's several new faces, so if you're interested in getting the emails about our programs, there's a small piece of paper on your table. If you fill that out and get it to any of us with the green ACAP shirts or Nikki in the back, we'll make sure you get added to our mailing list. And our next program is August 13th, and that's called From Driving to Passenger, the Driving Fitness Program and Transitions for Older Adults. And so that's going to go over some of, how do we kind of look at when we get to that situation that somebody may not be safe driving, some programs that can maybe help with that. And that's going to be Noah Alper and there's one other person, Joe Fitzgerald. So that's going to be the second Tuesday in August. And the other sheet that's on your table is the feedback form. If you can also fill that out and give that to any of us, we would appreciate it. The resource table is in the back there. So Shannon's information is at the far left. And then kind of some of the other speakers that we've had, other resources that we feel like could be helpful are also there. So if you don't see something that you're looking for, also ask any of us and we can see if we can direct you to the right thing. So thank you and hope to see you in August.
Thank you.
Thank you.
How are you doing? Good. Oh, yeah, yeah.
See, that's about driving. I don't think we knew that.
Right.
Yes.
Oh, you gotta find out before you lunch with you. I mean, that's the other thing. We have so much time. I know for that it is, but. Right.
My dad did everything for us. Good. It was.
So there was nobody else.
That's me, that's what I'm afraid of.
Yeah, my dad, he's got a box for him, a box for him.
I think we would do one of the closet organized.
Mine looks like my box. We should go.
I'm more like you than my grandma's.